What is a mid-facelift? There are a few different techniques that people will call a mid-facelift. Some surgeons used to do an endoscopic mid-facelift with very small incisions in the hairline. Some people will use threads and call this a mid-facelift. Other people will make incisions around the hair and the ear and lift between the lower lid and the jawline and call this a mid-facelift. It's very important to ask your surgeon when they say mid-facelift, what exactly does this mean? What are you lifting and how that is going to look on your facial features? Most surgeons will mean mid-facelift, lifting between the lower lid and the jawline. How long does a mid-facelift last? This varies widely based on the techniques that are used by the surgeon. There is not one specific mid-facelift that will last a certain amount of time. There are a bunch of different techniques that surgeons can use to lift the mid-face. How many sutures are they using to lift the muscles in the mid-face? Are they lifting above the muscle, below the muscle? How far medial or towards the nose are they dissecting? All of these things will affect how long this lasts. You can do a very quick mid-face lift. You'll hear of lunchtime lifts, things like that that take only an hour to do. The chance that that's going to last you a very long time is on the lower side. So that may be a few years, that may be a year. But if you do a true mid-face or mini lift where you're lifting the muscle back up to where it's supposed to be, this could last you 8 to 10 years. So this is very important to ask your surgeon, what does that mean? How are they going to be doing that? Is there one suture that's going to be holding everything up, or will it be a lot of different sutures that's holding it in a natural position? What is the difference between a mid-facelift and a mini lift? For some surgeons, this is basically the same thing. You're doing the same incision around the hair and around the ear to lift that middle portion of the face between the lower lid and the jawline. For me, this is basically the same thing. I'm lifting the mid-face with my mini facelift, or I can even call it an upper facelift because you're lifting this portion and you're not lifting the neck. Other people will specifically lift the mid-face through an incision on the lower lid. So you'll do a lower lid surgery plus a mid-facelift. Some people place a hair in the hairline and we'll use big sutures to go between the hairline and the cheek to lift it. This can mean a lot of different things for a lot of different surgeons. And so ask a lot of questions about what does that mean for that surgeon. For me personally, I place incisions in places that they heal very well, that you're not going to be able to see that with your hair up or your hair down. And I lift that the same way that I would lift that in a facelift to give you that long-lasting, very natural appearance for 8 to 10 years. Have questions? I help people like you every day. Call or email to schedule a consultation. Thanks for watching.